So we have Lynn and Ramona, Summer, and more something, and more people, and Amy. So this is great. Thank you for attending. This should take a half hour, roughly. I wanted to introduce you to a project we're working on. And gosh, I actually, hang on a second. We just developed some bookmarks. Not sure how well you will be able to see this, but it's a bookmark that has the address of the website. And so this is something we'll send out to you, and you'll be able to send to patrons just to make it easier to direct them to the project website. And our tagline is a reliable road to consumer health information for Nevadans. So having said that, okay, we can all talk to each other. No one's muted. So if you have a question, just feel free to jump in. But I want to move to a short PowerPoint presentation and then take a look at the actual website in real time. So Zoom, let me share the screen. Okay, so can you see this?
Yes. Yes.
Awesome. Let me plug back in. Slideshow. Beginning. Okay, great. So first of all, the topic is providing consumer health records, helping you better serve your patrons who come in for health information. And the problem, you've all seen this cartoon on the internet, nobody knows you're a dog. Anyone can have a website, anyone can put health information on the internet. And so you have this huge problem of people finding unreliable information and trying to kind of use that to manage their own care. How's the audio? Is it working?
Yes.
Okay, good. It's breaking up a little for me. Okay, so the primary purpose today is for those of you that I didn't have a chance to meet in person to introduce this website that we've developed. And it's the Consumer Health Information Resource or Connection. We're calling it the Consumer Health Information Connection for Nevada. And as you'll see, it has kind of a wide spectrum of information organized into categories to hopefully make it easier for you to lead patrons to the appropriate resources. So the website is not a source of originally developed content. It links to places that have been vetted and authoritative and websites that clearly present useful information. So that was our goal. And the reason we did this is if you search for information on the internet, there's a long story behind this, but here's the 14 amazing benefits and uses of papaya fruit, and it makes the claim that papaya can be used to cure kidney stones. If you see this line right here. So if a patron saw that, they go, well, sure, I guess I'll start eating papaya. And they don't know how to evaluate the validity of health information. One of the things, if they see something and ask you, well, why shouldn't I trust this? One thing you want to ask them is, well, where are the references to the article? They make this claim it's undoubtedly one of the most nutritious fruits. There are no references. There's no pointing to actual evidence. So that's the first thing that you want to make people aware of, that when there's information or claims made on the internet, it needs to be backed by evidence, by a list of citations that support the claims that are being made. The other thing, and I'm sure you do this as well, but you want to look at the website and see who is the person or the organization behind the information, and you probably know if it's like a .gov site from the government or an organization or even a .edu coming from like a university or medical center tends to be more credible. When it's a .com, it could be anybody who's just selling products. But go to the About section and you can see that this guy is a health crusader. Anytime you see something in quotes, that's kind of a tip-off that there's something kind of suspicious about it. He is, in quotes, a health practitioner, and this is his, quote, wellness space. So anyway, that's an example of what's really egregious about health information on the Internet. So we're trying to allay that. Some of the problems that patrons have is that the technical level is unsuitable. They can't determine the credibility or the authority of the source because they're not trained to look for things like where it's coming from, the domain, or to look for the source information. They can't determine how current the information is, and that's a problem not just with consumers, but sometimes medical professionals. They go to a website and can't find out how old it is. Just a couple of things, because people often say, well, don't use Google. Google's terrible. And we're kind of changing our mind about Google as a way of finding specific information. I just wanted to share one thing that's useful when you're searching Google is to combine it with the word review, because review comes up a lot in the medical literature when they are kind of coming up with a summation of the current understanding of a condition. And as you see, by searching review, we have this review article in the New England Journal of Medicine on psoriasis, clinical implications of treatment for review in this article, possible updates in a side-by-side treatment review. So review, if you are using Google to search for something, combining it with a review can be very productive. The other kind of word that tends to be very productive in getting information that's clinically relevant is the word indications. It just happens that that's how physicians and medical researchers talk. They talk about indications of a disease or a symptom, or indicated or indicates. So especially if you are dealing with a symptom like headaches, you can combine that, headaches and indications. And generally, you'll find a discussion of what the implications are of that particular symptom. So if you're using Google, a couple easy techniques to try and get information that's a little more relevant. So what are concerns that patrons have about coming to the library? And you probably experience this far more than I do, but some of the things that create problems, they're unfamiliar with the terminology. They're concerned about vulnerability and exposure of their privacy. They want you to interpret the information for them, which, obviously is something that's prohibited by just common sense, as well as all these guidelines that are developed by the ALA. And I'm not going to discuss those in details, but there are many, many guidelines dealing with how to kind of correctly and safely provide health information to patrons. And one of the things that is paramount is that you never want to interpret information. And it's a good idea to have some kind of disclaimer, your reference desk saying, exactly what you can or can't do. A couple good questions to help you manage the reference interview. And again, there's a lot of information about empathy and body language and making eye contact and all that. And those are things that you can find, and I could send some links to point to those articles as well. But just for the sake of time and to get to some things that I think are most productive, some good questions to ask. You want to find out, what's the information for? Because sometimes people will come in, they're writing a paper for school, and they just need to write an article about a disease. You want to ask them, who is it for? And, there's some questions about, privacy and whether this is intrusive or not, but it's really helpful to know, is this information for you or for a friend? who actually needs the information, because that can be very revealing. And also, how much do you want to know? Some people want to know everything about a disease. Sometimes they just want to know some very specific sliver of information about a disease, like whether it's therapy versus diagnosis versus prognosis. And prognosis is concerned with outcome. Like if you have a disease, how likely are you to be cured? How likely are you to live through the disease? And then this is a question that I find especially useful because people come in and they're not, perhaps they're not really revealing what the background behind the question, and you're not sure, do they have a diagnosis already or do they just suspect? I have a cousin that thinks he has rheumatoid arthritis, and he tells me that, but he's not seen a doctor yet. But he's still saying, well, I have rheumatoid arthritis. So I ask, what information has your doctor already given you? And the reason this is useful in teasing out information is if they haven't seen a doctor, they'll say, oh, well, I haven't seen my doctor yet. Oh, well, that's interesting. So what are you basing your diagnosis on? Oh, I just have some suspicions, or I went to a website and I think that that's what I have. Versus, oh, my doctor has already told me this. And the problem with kind of patients looking for additional information, when you see a doctor and they tell you you have a disease, and especially if it's a severe one, there's a shock factor. You may have gotten a lot of information, but you're not receptive to it because you're still processing the idea that you have Huntington's chorea or brain tumor or whatever. So it's good to know whether they have gotten information from the doctor, and you to ease into that, you can say, well, I don't want to duplicate a lot of information you've already gotten, so I'm just curious, what information has your doctor already given you? That way it seems less prying. You set up the question by, doing them a favor. You don't want to kind of waste their time. You want to use that time most effectively. So, let them know, just so we don't overlap with what you already know. What information has your doctor already given you? I find that a good strategy. And then it's a good idea to have disclaimers and caution statements. This is something I borrowed from a different presentation, but let people know that the materials are just opinions of the authors, not attempt as a substitute for the advice of your healthcare provider. Don't rely on this without seeking medical treatment or advice from a healthcare provider, and that's just to get you off the hook. Okay, so let me get out of this and go live to our website. Any questions so far, things that you specifically would like to know more about? Are we still there?
Yes. Yes.
Okay, excellent. Okay, so this is the website we've developed, and the first thing I want to make clear is that it's still a work in progress. I mean, we have put several hundred resources into this and tried to organize it in a way that makes sense, but there's room for improvement. I'll just say it like that. There's certainly room for improvement, and we're looking for feedback from you all as you use it. If you look at it and say, boy, I found a resource, but it doesn't make sense that it was in that category, maybe you can move it here, or these categories aren't intuitive. Could you reorganize it or rename some of those categories? Some things hopefully are very, very clear, very obvious. We have, for example, multilingual resources. So if someone comes in and they speak Spanish or Farsi or any other language, we have a link to a resource with commonly used clinical phrases in various languages. So again, a number of these, and some will be more useful than others, so you have to kind of take a look and see which ones are going to work best for you. One of the things that I think is useful right off the bat is that we have a section on databases and dictionaries. This needs to be reorganized a little bit, but we have not only like a link to Stedman's medical dictionary, which is the kind of the standard medical dictionary that a physician or a nurse would use. But we have some things made specifically for the lay public. So here is a plain language dictionary, and this was developed by the University of Michigan. And so when someone has a fancy medical term, they don't know what it means. Like you always hear when someone has an accident that they had a contusion. Okay, you can come down and find out that a contusion, oh, that's actually a bruise. Okay, so you can type in a term, you can browse terms just alphabetically. So if your doctor says that something is malignant, well, they may not know what that means. So a malignant tumor, a cancer, tumor, mass. So dictionary that can help patients better understand the terms surrounding their condition or their question. Does that seem like something that would be useful for you? Yes, I'll take that as a yes.
Yeah.
Okay, feel free to speak. I'm just trying to make this a little more interactive. So we have common diseases, and we're not trying to replicate websites like the Cleveland Clinic or the Mayo Clinic or Medline Plus that have every single disease, because that would just be redundant. But we're targeting like the 10 most popular, or not popular, but most commonly asked about diseases. So we have AIDS and resources under AIDS, Alzheimer's disease, and arthritis. So if someone has a question about arthritis, and what we've tried to do in most cases is have an annotation that will tell you a little bit about the link, where you're going to, what their purpose is, what kind of information you can find when you go there. So, here's the Arthritis Foundation, for example. And then, if someone has a question about arthritis, you could go to the arthritis section and say, oh, here's a website that has a lot of information, and, knock yourself out. One thing to know, too, is that the links are, the link window is embedded within the construct of the website. So it doesn't open up a new window. You just click the back arrow key to get back to this website, which we find is a little more comprehensible for people. It doesn't open up a new window and take them to some place and create navigation problems. So common diseases, we have symptom checkers. So if someone has a symptom and they want to do a little self-diagnosis, you could come down and select ankle problems, and then it takes you through a kind of a matrix of questions that you answer, and you can say, yes, I had swelling, and there's significant pain, and then gives you a possible diagnosis. Not a good substitute for seeing a doctor, but for some people who don't have access to a family physician or they're reluctant to seek medical care, it could be a good starting point. We've seen databases and dictionaries. Drugs and medications, this is a question, or questions that probably come up most often for us. Someone gets a prescription and then they want to know all about the drug. Oh, okay, we only have 10 minutes left. Stay with free, sorry. Daily Med is a good website, which has the drug information labels, and was it the contraindications and side effects and all the other information. We have just really too much to show. The drug information portal is probably just one of the best places you can go just to get drug information, side effects, proper use of the drug. We have a section on health insurance. So just a lot of stuff here. There's really more than I can show you in 10 minutes or in hours. But the key takeaway is, or we've organized information by general categories that seem most commonly occurring, or there's the strongest need for information on those topics. We have addiction resources. And what we would like is to have your input. So as you use this tool, let us know if it's working for you, how it could be improved, what kinds of information is most valuable or least valuable. Like we already are probably going to combine exercise and nutrition and healthy lifestyle into one category just to make it more clear. There's a section on talking with your physician. So to understand commonly used clinical phrases, help in finding a health center, Nevada health centers. We try and have a lot of Nevada-centric information here. Toll-free numbers, et cetera, et cetera. What did my doctor say? Just to help people prepare for a doctor visit or understand what just happened after they've seen their physician. Pregnancy and prenatal care. Again, general resources, information about pediatric care and infant care, milestones and developments. And then one thing we also want to do is develop an FAQ of commonly occurring questions. So there may be questions that you field again and again. And if you have a topic that is very popular, like how do I treat Crohn's disease or whatever, let us know. We'll try and find kind of a resource that can address that specifically, or even develop something kind of in-house that can address that question, and we'll add it to the FAQ section. So what else? Oh, and okay, the search function, we're working on it. It doesn't quite work, but we're fine-tuning it because what it's doing right now is, I think, searching the entire library website. So we're working with a programmer to get it to just search this page, if that makes sense. If you're familiar with LibGuides, I mean, this is a LibGuide, part of the Savant Medical Library set of LibGuides. So right now, this search function is searching all of Savant Medical Library. We hope in the next couple of days that the programmer will figure this out, and it will only search this set of LibGuides, which will make it, I think, far more useful. And I'm very confident that we'll get the search guide to work properly in the very near future. Okay, I'm about to run out of time, but let me ask what questions you have. How can we kind of make this more useful, and what kind of follow-up might be valuable for you? Anyone?
No, we don't have any questions.
Okay.
At the moment.
You think this will help in your encounters with patrons?
Yes, definitely.
Okay, terrific. And lastly, I'm developing just a short survey, like 4 or 5 questions about the website. I'll be sending this out in the next couple weeks. I want to give you a chance to be able to look at it and reflect on it. And then we'll send out a kind of a SurveyMonkey survey, just an online survey asking questions about your perceptions and maybe and reactions, and perhaps how we can make the website more useful for you. And how.
Okay, sounds good.
Okay. Great. If you have any questions, Amy has my email address. You could always shoot me an email or call me. That'd be great. But I thank you for your time. This is good, and I hope that we can expand this and actually take it to other public libraries in the state as we get a better sense of how well it works and kind of fine-tune it and make it more adaptable to the needs of public librarians. Okay?
Okay, well, thank you so very much.
Thank you.
Oh, you're very welcome. And I hope this is becomes a valuable part of your arsenal in helping provide consumer health information to your patrons. Okay.
Okay, yes.
Thanks again.
Thank you.
All right. Bye now.
Bye-bye. One person available before voting.